Good afternoon. Health and Human Service will come to order. Madam Clerk.
Commissioner Baker McCormick,
Here.
Commissioner Marecki, Commissioner Anderson, Commissioner Colleen, Chair Scott.
Present.
You have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
I have none. Next item, please.
C, approval of the March 10, 2026 meeting minutes.
Move approval.
Been moved by Anderson, supported by Marecki. All in favor?
Motion carried.
Next item, please.
D, unfinished business. There is none listed.
Okay, next item, please.
Moving to item 1 under new business, requesting commission approval of Amendment 1 to a 1-year continuation grant agreement with the U.S. Department of Health and Human Services, Health Resources and Services Administration to support the continued operations of the Wayne County Healthy Communities, 2 federally qualified health centers.
Is there anyone want to talk about the 2 health centers? Yeah, thank you.
Good afternoon. I'm Javar Jackson, the CEO of the 2 federally qualified health centers, namely Wayne County Healthy Communities.
Thank you.
So this line item, we received a extension grant for expanded hours, which extends our clinical hours past our current hours for 2 of our clinical sites. We received that initial grant in 2025. This is a continuation of a one-time allocation of $250,000 to continue that work.
Okay. Thank you. Does anyone have any questions? Commissioner Marecki?
Yeah, thank you, Madam Chair. So when this money is used up, are you planning on trying to get more? Are you going to decrease the hours again, or?
The intention behind the extended hours is to sustain those hours after the grant is done. And so while we do take care of patients or the services through this grant, we're supposed to build sustainability through revenue generation. So it's anticipated that we'll remain with those hours after funding is over.
All right, good. Thank you.
Thank you. Commissioner Colleen?
Thank you, Madam Chair. And just to classify, I heard you say 2 of our clinics, which to me implied there's more than 2.
No, it's just
But
2.
Yeah, I know. I just wanted to clarify that.
Well, at this time, there are 2, but as of May 1st, we will have 3. And so that 3rd location is not covered under the $250,000 as it is
Right.
a new site. Once it becomes a new site, then is eligible for the grant funds to be extended to that 3rd site.
And that will be an FQHC?
That is correct.
Yeah.
And where will that be located?
That is inside of Garden City. That will be side of our continuity residency clinic in Garden City.
Okay.
Thank you, Madam Chair.
Why was Garden City chosen?
Pardon me.
Why was Garden City chosen?
The service area has a increased need of both geriatric population as well as increased Medicare and Medicaid population. We, being a part of Wayne County, have a jurisdiction that spans across the 43 communities. And Garden City is the next best option in terms of viability and support for those distressed communities. It was also a great opportunity for us to partner with the hospital to start an internal medicine residency program, which will serve as an option to bring more providers into that community that focuses on internal medicine, so adult patients above the age of 18.
What's the hospital over there?
Garden City Hospital.
It is Garden City Hospital. All right, thank you. Okay. Commissioner McCormick, oh, are you finished? I'm sorry.
Yes.
Okay, certainly. Commissioner McCormick.
Thank you, Madam Chair. The new location, will it offer the same services that are offered at the
other locations like dental and will it have the same?
According to HRSA, we have to apply and provide all core services at all sites or offer a opportunity to get to those sites. So day one, that site will only provide primary care as we build volume, as we build capacity. But as a future sense, we will bring on-site dental, behavioral health, and other core services. Of record, it is around 10 miles from our Wayne location, and we utilize Uber Health to support any transportation gaps. So should a patient need dental day one, we can get them to the reporting or next best adjacent site, which is at our Wayne location.
Okay, and do you see an increase in these services or requests for services at the locations, or are they about the same year over year?
Really good question. As of last year, we saw a 9% increase in volume and demand across all services. Part of that, which this expanded hours work will support, is including more advertising in the community of those late hours, as well as service options. We are a clinic that sees patients regardless of their ability to pay. And so being able to share that narrative in the community is viable and important, in which we are working to do a better job in
Okay.
all of our service sites.
And speaking of sharing information, do you have a one pager that we can share in our communities that you already have together or you can put together and either with just the two sites or the grand opening of the new site or something like that?
Yes, and
Yeah.
I can get those to you.
Okay. If that can be in a shareable form, so we can share it on social media. Thank you, Madam Chair.
All right,
That's
thank
it.
you. Commissioner Kalina.
And
Mhm.
one question that came up during discussion. So federally qualified health centers, the feds set up to serve underserved communities. And the reimbursement rates to a federally qualified health center are higher because of that. You mentioned getting people rides to the clinic. Is this 250,000? Is that part of providing the resources for the clinics to be able to provide transportation?
Annually, we budget based upon last year's impact of transportation into our operations budget, rise for Uber Health. So in short, this funding is not enough to support additional rides, but we anticipate usually 10% more each year so that we can ensure that we cover the service areas appropriately.
Do the feds say anything about their reimbursement that getting people to the clinic, however you do that, is permissible under their money?
Correct. So
Okay.
two things. We are required to provide transportation under HRSA for where necessary, and that's to and from any clinical appointment.
Okay.
So we can't, obviously, some patients want to go to the grocery store, right? Or they want to go to the drugstore. Unfortunately, we have to ensure that we're getting them to and from meaningful care, and that is allowable.
But that, yeah, so that's since they mandate it, the feds mandate it.
It
then
is
the
not
higher reimbursement rates to those clinics take that into account.
correct.
Okay, great. Thank you.
All right, thank you.
Thank you, Madam Chair.
Okay, Commissioner Anderson, I'm sorry, I didn't see.
That's okay. That's okay. Is the location of that in Garden City going to be where the city had taken over a school that was closed? That I guess I was asking, but that's, do you know where it's going to be right now?
It will be inside of the medical office building on site of the Garden City Hospital. So there are two buildings adjacent to each other. One is the hospital. The next building is the medical office building, and we'll occupy that space.
Okay, thank you.
All right, Commissioner Mareki.
Thank you, Madam Chair. So if someone comes into the clinic and needs to go to the hospital, then are we involved in any of the payments at the hospital?
We're two exclusive entities. So whenever we can make referral, just like if we were at a standalone site and we have to send somebody via ambulance to the hospital, the patient is accountable for whatever expense that goes there. We do try to work through relationships for patients who have established care through our health center, such that they will honor either our slide fee discount, which makes a more affordable option, or that the hospital employs a good faith charity care policy to support, any of the care needs post being inside of a clinic setting.
All right, thank you.
Thank you. Any others? Okay, thank you so much.
Thank you.
All right. Okay, I have a motion.
We have a motion by Commissioner Baker McCormick and a
Okay.
support by Commissioner Colleen.
Yes, thank you. All right, and I vote yes.
Motion carried.
Thank you. Next item, please.
Item 2, requesting commission approval of a grant agreement with the State of Michigan Department of Licensing and Regulatory Affairs Cannabis Regulatory Agency to provide education, communication, and outreach services regarding the Michigan Medical Marijuana Act.
Good afternoon.
Good afternoon, Commissioners. Dr. Brianna Eccleston, and I am the Public Health Division Director. And this is for requesting for a grant acceptance of the Medical Marijuana Act, and for the amount of $562,581. Sorry. And we will be utilizing these funds for our outreach team that we employ over the amount of the grant, the length of the grant between January and November. I'm sorry, not November, September 15th, and also for advertising for our medical marijuana safety campaign, which is usually targeted to reduce teen use, and also for just educating about also safety use of locking up any medical marijuana or marijuana safety, additional, and keeping out of reach of children, and additional things. So we often, our outreach folks usually will host parent-focused training on safe use and youth prevention, and also family communication around marijuana use for their youth. Presenting information shared with our maternal child health programs as well, and distribution of educational materials to dispensaries. Marijuana edible safety materials are also distributed, and then education on youth, with young drivers with driving schools as well. So we do utilize these are all the places that we have our outreach teams do the education.
Okay. Are there any questions? Commissioner Colleen?
Oh, I'm just moving it, Madam Chair. Thank you.
Oh, okay. And since there are no questions, then it's been moved by Commissioner Colleen, supported by Commissioner Marecki. All in favor? All right.
Motion carried.
All right. Thank you so much, Doctor. Next item.
Item 3, requesting commission approval of a 3-year sole source software as a service agreement with Metapio for the development and launch of the Wayne County Health Atlas, a dynamic, interactive public health dashboard to enhance visibility into public health data and access to policy map.
Hello there. Aja
Hello.
Harris Martin, Chief Programs Officer for Wayne County Health, Human and Veteran Services.
Good afternoon, Dr. Carolina Stiliano, Chief Epidemiologist and Data Officer for
Great.
HHS.
Thank you.
So we are excited to bring this forward to Commission. This is part of our Well Wayne strategy. This is under our kind of community health blueprint, providing data and access to data to all of our residents across Wayne County, especially for those priority health needs and other interesting things that we hope will help commissioners, things that you all have asked us, you'll have in real time for statistics and demographic data and health data for your kind of districts and your areas, as well as other community-based organizations have told us that they're looking forward to something like this, and philanthropic organizations as well to point where their dollars are going. So we're excited to offer this. Dr. Stiliano can talk more about what Metopia and Health Atlas can do for us, but it's been a year in waiting since I think we mentioned this to you all, so we're excited to hopefully get it launched before the end of the summer.
All right. I don't see any questions. All right.
Okay, yeah.
Okay, yeah. So this is a data curation platform that comes preloaded with hundreds of indicators that expand from demographic, socioeconomic, behavioral health, hospitalization, and other health outcome data. We also have the ability to load our own de-identifiable aggregated data for informing the public and sharing part of what it should be accessible to our constituents and our partners in a friendly, user-friendly, accessible manner. The platform allows us to share the information in different geographies. So think of census tract, zip codes, municipalities, as well as the county. Also over time, so we can understand trends. You can compare different jurisdictions. You can compare information over time within Wayne County, in contrast to Michigan and national trends. And we believe that it will make not only our work more efficient, but make the information more accessible to the public, that they can allow them to make more data-informed decisions. And it will also increase our community engagement, both with the public and our partners. So we are very excited to have this platform as the first jurisdiction in Michigan to offer this.
All right, well, thank you both. Any questions? I don't see anybody up. Commissioner Mareki?
So it's you're going to get it preloaded by this company, and they were doing all the they're doing all the work to get all those stats themselves.
So the platform comes preloaded with publicly available data sets. So think of the information that CDC provides in different data sources. Typically, they pull the information once a year and they curate it to the jurisdiction that the platform is tailored for. So they have a number of databases, both publicly and some of them they pay. So they're private data sets that they preload to all the individuals that are customers essentially of the platform. In addition to that, we as the back-end developers of the platform have the ability to add information to the platform. So a lot of times things that we are using for the community health assessment, for example, might be relied on the state to release the information. So these will not be preloaded in the database, in the platform. We will have to curate the data in a certain way, de-identify them, aggregate the information, and upload it to the platform, and then it becomes available to everyone.
Okay, so this company that the contract's with will do all what you're saying, the local stuff. I mean, besides the pre-loading, who's going to keep up with it?
Yeah, they're hosting essentially a database.
Okay.
And then the database is being called by the interface that the user will use. And it will call different information, different metrics over different periods over the geography that the user determines.
Okay. Okay, so they'll get stuff from the state and they'll get stuff locally, what we're doing here.
Exactly.
Seeing, and then it all, how about so in CDC is the preloaded, but are we going to get anything from hospitals in our local?
So that will be up to us. We do have a plan on what information will end up there. Initially, we'll rely on what is preloaded. The next level will be what we typically use or we get requests to release as a public health department. And then the rest will be based on the need and what is being requested or what our strategies are needing.
All right, thank you.
All right, thank you. Any others? Commissioner Kleen?
Thank you, Madam Chair. And good afternoon.
Good afternoon.
Listening to your description, this is not like an open database.
No, it's not.
It's not like Wikipedia where people just get on and say, oh, I got some data. I can.
No, this
So
is
does the,
so Metopio, the company that offers its platform, organizes the data that are either offered by their platform automatically and is available to all their customers, or us as the health department can upload whatever data we determine is needed for the community.
okay. Do you have like a list of the kind of data that you're using on there?
So there is a list. Overall, there's typically the databases that they are preloading, and it includes most of the CDC's publicly available data. We do not have a list of the private data sets that they're purchasing and offering, but we can provide that list.
Yeah, because you know, blood pressure, obesity,
We'll have all that.
okay, you're gonna have that. Has the county discussed our needs for that website? Or is that an ongoing conversation of things that the county wants there? Because it's almost like would take the place of a community health assessment or something like that we've talked about.
Yeah, so it wouldn't take the place, it would just help us collect that data more efficiently and more routinely. So like now
You know,
with
plug it into your plan.
yes, essentially. So like now with Katarina, for instance, when we underwent the SNAP response, we had to FOIA, and you know, we didn't have to FOIA the state, but we had to go request the state database and then wait 2 weeks for the state to send it to us. And now it's on SharePoint. But that's something that Katarina could upload to Metopia. And so now you all have access to the latest data that we pulled, which was December 2025.
Yeah,
So that's what we're
anybody
kind
can
of
get on and look at this, right?
Mhm.
So I want to make sure, because we have health advocates out
Mhm.
there and nonprofits and whatnot, that the data is extensive enough where it's very useful to a local group.
Yeah, and that's
So-
what we're hoping for. And so you all could, if you all want to see another health metric on there that you don't see, we have the opportunity to request it to Dr. Steliano's team to see if it, you know, we can put it in maturity, right? Like when we could kind of load that and then get it. So it'll be a turnaround.
You have an opportunity? Is that a window that closes?
No, it could be, no, it could be throughout the length of the
Okay, I just
contract.
want to
Yeah.
make sure,
So no,
yeah.
if something comes up, yeah, you
Yeah.
request it. It just won't be tomorrow, right? Because we have to find the best data source and then see how frequently we can upload it, et cetera. But no, it's an open window.
Okay. And my last question, Madam Chair, and
Mhm.
Commission Council is right on time for this. We were provided 5-6 pages of questions and answers about this, council. And you note at the end, you know, at the end of the questions and response, let's say on item 6, that council comments the agreement was revised to address this concern. I didn't see that for every one of the 15 questions. Are there anything about this that has Commission Council concerned about this contract at this point, after all the back and forth on questions?
Through the chair to this honorable body, so all of the concerns or revisions that we requested were made.
Excellent. Just want to double check that. Thank you, Madam Chair.
Thank you. Commissioner
That's what I was like. That was the main thing.
McCormick.
Oh, thank you, Madam Chair. So this is going to be basically a pool or a software program full of information that deals with health and statistics and things of that nature. So how do we determine where those sources of information is coming from? Like, do you have a list and you already know, okay, we're going to get XYZ from the state, from the city, from the county, and then we're going to pull all of this information into one space? Or you just mentioned to Colleen, if it was some information that we wanted or needed.
Mhm.
so we can kind of make it what we want.
So the platform is dynamic in the sense that it comes preloaded with a lot of the mostly used information and metrics that a health department typically will need to conduct a community health assessment. So the need behind the platform was generated that everybody needs to generate a community health assessment. So the preloading approach was that what is typically needed to conduct one. Beyond that, it's dynamic when a lot of customers are requiring the same data resource and they're doing it manually. The vendor might end up choosing to go ahead and provide that for everybody instead of each customer loading it by themselves. So there is a list, but it keeps changing, it keeps increasing. But in addition to that, we have the opportunity as in the backend to to upload information based on what we do within the county. It could be initiatives from the Wellwayn Station, from the Wellwayn initiatives. It could be strategies that the department is trying to promote and emphasize certain topics. So we have the ability to curate additional data from what is already there.
Okay. So would this also take data from our our morgue to say, you know, statistics of deaths related to XYZ,
Yeah, it
and
could.
then you can
Yes.
Yeah,
kind
it could. That's possible. And it'll at least the version that I've seen, obviously our version isn't launched. It will tell you what that data source is. So like if you think of age, for instance, right? Like the demographics of, you know, your kind of your district, depending upon what assessment you're looking at, it might be some variation. So in this system, it'll tell you the source for it. So it's not just like, oh, here's this random number. It'll
right.
say, oh, we're pulling this from CDC 2024.
So there's extensive documentation within the platform that each number comes with the definition of the metric, the source, the years available, the jurisdictions available, so that users can engage with the information. There's also videos that they can train individuals on how, within the platform, how to engage with the information and go in depth. And there's also a module for us to give storytelling. So curate a list of indicators that say focus on mortality data. Everything that we consider around mortality data is important. We can have a separate page within the platform that say, if you want to know about this topic, this is the list of indicators and the connectivity between the data to give the full story. Yeah.
Okay, great, great. And the residents of Wayne County can have access as well. So would it be a list or listed on our website and then they can click the link and then go?
So that's what we're hoping. Yeah, we're hoping to do a big launch around this after we do some testing. That's why we have a subcontractor as well. So we have Policy Map that gives us access to even more data. So once we'll probably do a soft launch with internally within Wayne County, see how you all like it, and then do a big launch to share with everyone. So like I mentioned earlier, our philanthropic partners, now they have access to data to see, okay, where should we point our dollars to as it pertains to food access or medical needs for seniors. So now they can use a data-informed approach, or our community-based organizations while they're applying for grants. Now they have access to information to bolster their applications, bringing more dollars into Wayne County, and or your concerned resident in block club, et cetera. Now they don't have to navigate the state because I have to call Katerina once a week. Like, where can I find this number? And so I know it's harder for all of our residents.
It's all
Now they have something that's
Exactly. That's what we are trying to establish, have a centralized location for individuals to access this information. Even for us, we do get these requests. And as the experts, it can take us weeks to collect all the information, clean it up, package it, and provide the story behind what this data is telling us.
Thank you. Thank you, Madam Chair.
Thank you. Commissioner Kling.
Appreciate it. I have one more question. Is City of Detroit data included?
So for the policy map instance, it will be included for the Metopio, the health atlas, because it's more of a public health and our jurisdiction is within Outwayne County. It's not.
Did you say
Exactly.
yes, Detroit
So we have
data is included?
asterisk.
It's an
So-
asterisk, and
yeah.
why is it an asterisk?
So our platform, the Metopio platform, is not including Detroit because it's focusing based on the health department's
Yeah,
jurisdiction.
yeah, R43, yeah,
The 42, excluding Detroit. Policy map,
Right.
which is a subcontractor within this contract, does include Detroit.
say that again.
Policy map is a separate platform that also offers data curation at the same approach as Metopio, and that includes Detroit. It has a different set of indicators that can be accessible.
So the data is not exactly the same on the two
No.
sites,
And that's why
but
we
it is
haven't
something I can send my Detroit constituents
two.
to look at.
Exactly.
Okay. All right. Thanks, Madam Chair.
All right. Thank you. It's been moved and supported. All in favor? All right, we all vote. Thank you. Next item, please.
Moving to item 4, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services to accept funds through the local community stabilization authority to offset costs associated with the delivery of services in the essential local public health services program, including food safety and hearing and vision.
Thank you.
No, thank you. Dr. Brianna Eccleston again, and I am here just presenting for the acceptance of the local stabilization funds through the Local Stabilization Authority Act of the amount of $705,069. We get these annually, and any of our they are basically eligible for any of our programs under the essential local public health programs, and that includes our food safety programs, our food safety program, hearing and vision, communicable disease, STI. Those are eligible for these funds. So we determined what are the additional costs that we could supplement utilizing these funds. And so we have our food safety program that will be utilizing this to support 3 additional of our positions that we have filled now for environmental compliance technicians. And our software needs also food safety campaigns. So we are hoping to do a little bit more of just publicizing a lot of the initiatives that we're also having in our food service program. And so that'll include letting folks know about our plan review courses that we're offering, as well as also they're helping us kind of be refined on Google search. So if somebody wants to look up, how do I obtain a food license in Outwayne County? This will also help us kind of breach one of the first items that you can look at and be guided to our website that will provide all of that information. And then this will also be used for hearing and vision for the additional staff that we've just added onto our hearing and vision our hearing and vision team. And so this will just be providing those updated hearing and vision equipment. So.
All right, thank you.
No.
Any questions? Commissioner Kling?
Thank you, Madam Chair. Well, hi again.
Hello.
These dollars, one of the things you commented on was to support 3 positions.
Yes.
Now, we accept this grant.
Mhm.
Does that mean that's the new baseline? And so we will get this money again next year?
Yes, yes. So this is our baseline, and any of our unused dollars from any previous years will just be rolled over. The state doesn't give us any reporting requirements of, we get to set this aside for our pool, just an additional, like if there's any additional needs and offset costs for any of these programs that are eligible for it, we can be able to just utilize those funds. And that's been requested before when we've like had to in certain programs and we've had to pay out, give our staff at least additional 30 days before we've had to close that program, we would pay out of the local stabilization funds.
Okay.
But yes, the
Going over
baseline.
access funds, huh? Didn't want to hear that. So since this 700,000 and change supports 3 positions,
Yes,
we will have that 700,000 next year too,
yes.
so that things that we do to gear up on behalf of the state don't go away in a year based on the grants. Is that accurate?
I will say I will ask the question again. Just so I understand exactly what you're asking. Yes.
Well, over time here, because the state hasn't done this forever, and we saw like a chart from whatever 5 years ago.
Yes.
And there's been about $2 million that the state has sent us over that period of time.
Yeah.
So do we receive that money year over year so that we don't get a grant one year and then the next year they're not funding it and we're like, okay, sorry, you can't work here anymore. We're going to cut this program.
Yeah, no.
So this forms a base.
Yes, this forms a base for this specific funding, but this does not like supplement for any other grants that are going to reduce because of the use of this.
Yeah, I would hate to. Okay, real good. Thank you.
Yep, no problem.
Thank you. Commissioner Marecki.
Thank you, Madam Chair. So we have a summary of the agreements, and it looks like 2024 is missing. Was there a problem in there?
For that one, we had already like decided where we were going to utilize those funds. So we did that at the beginning of the budget, like fiscal year. So that was already set within that time. And then we use that mainly for our funding for our positions still that we have that are supported by that. But we did do that at the beginning of the fiscal year.
But we did get funds through the local community stabilization.
Yes.
In 2024. Okay,
Yep.
I don't see any indication of that. That just could have been, that's not your problem. Probably. Is that what you were talking about?
Yeah, I was looking at that chart.
Yeah,
Okay.
but we did get something then.
Yes. We have the same amount that's given to us every year.
Yeah,
So
and back in 2020, it was 811,000. So it has gone back down, but it's been pretty steady the last 3 times.
Yep.
So with the food safety, is that mostly the food inspections?
Yes.
Okay.
Yes.
In the restaurants and wherever?
Yes.
Okay.
Yes.
Okay. All right. Thank you.
No problem.
Thank you. Anyone else? All right. Hearing none. I have a motion by Commissioner Colleen, supported by Commissioner Marecki. All in favor? Okay. All right. Motion carried. Next item, please.
Moving to item 5, discussion with Southwest Counseling Solutions and the City of Westland.
Are they here? Thank you. Want to state your names, please?
Jamie Warren. De Leon. Marquita Felder.
Is your mic on?
There goes Jaylee Warren. Haley De Leon.
Okay, thank you.
Marquita Felder.
Okay,
Southwest Counseling Solution, now My Side Impact Network.
We're with Westland Youth Assistance.
okay. All right,
Rachel Davis, Department Director for Juvenile and Youth Services.
thank you.
Good afternoon to this honorable board. Nathaniel McQueen, Chief Program Officer for Juvenile Youth Services, Wayne County.
All right, thank you. Go ahead. Who wants to start?
So we'll start. So our program, we are a prevention and diversion program. Our goal is to help youth in the community. Most of them are going down a path towards the juvenile justice system. Our goal is to get them on the path to steer them away from that juvenile justice system. Currently, our program consists of quite a few components. They are not required for every youth due to trying to personalize it to each youth's needs. We offer case management. What that looks like is every week we have to have face-to-face contact with that youth. We offer life choices peer groups. During those groups, they learn life skills. We use Dr. Botvin's curriculum. We also do a parent guardian support group. Our goal with that is to get parents involved, also provide them some support and education. We do social life skill events. Those are every Monday and Thursday. Those look like fun activities for the youth to really gain some healthy communication skills and positive peer interactions. And then we also offer a sexual education workshop. During that workshop, they're able to learn refusal skills. They're able to learn about STDs, STIs. So altogether, we have a lot of different things that we offer our youth. And then again, we do tailor it based on the kids' needs and the family's needs and concerns.
How many students do you have?
Currently, I believe we have about 65 in the program. Yeah, maybe 80 total enrolled, like close to 80 probably would be between 60 and 80. But we as case managers, we manage a caseload of up to 20. So there is 5 case managers, and due to how the program works, because they're kind of all completing expectations at different times, obviously, our caseload will vary. So some of us will have more, others will have less, but I would say close to 80, between 60 and 80. But I wouldn't know that exact number because I don't oversee the amount of enrollment that we have.
Okay. All right, Commissioner Marecki.
Thank you. So is this just youth assistant program?
Yes.
There's no CMO. It's just
No,
the
we're
youth assistant.
youth assistants as
Okay,
well.
this is new in Westland, right? Isn't this new?
No, we're not new.
Okay.
We're like decades we've been around.
Were you funded by somebody else? Now you're being separately funded?
Yeah, I believe so. So we used to work under kind of like an umbrella, and now we've separated onto our own, and we're overseeing our own court referrals and stuff. So
This is the first year of
yes,
that?
yeah,
Okay, okay, yeah, I knew there was something there.
yes,
Okay.
yeah.
Okay, all right. Okay, I'm good right now.
Oh, Commissioner Anderson.
Yeah. What necessitated that change? Do you know?
I think we were just growing at a pace that made it difficult with the area that we work at, right? We're so close to Wayne County, they have their own family services, they have their own youth program, Wayne, not Wayne County, the city of Wayne. And the overlap between the two just became kind of difficult the way that we received cases. So it kind of allowed us to bypass that and just become our own division of youth assistance and to receive cases separately from trickling down. So I believe we worked under GrowthWorks, and they used to oversee our court referrals. And they would kind of decide where those cases went. Now, by default, we no longer have to do that. So we just get them, we just receive them. There's no filter they have to come through before they get to us. So it's allowed more freedom for us and more kids that we get to serve around our community.
So is Paul still involved with,
Yep.
this program?
Yep.
Once you meet him, you'll never forget it.
I know.
Oh, yes.
He's something.
Thank you. Thank you, Madam Chair.
Commissioner Kleen.
Thank you, Madam Chair. I heard you say court referrals, but you made another statement, because we do have other programs where you try to get the young people before they have a, let's say, formal relationship with their local court. Are you handling both kinds?
Yes. Yeah. So we receive referrals from, we offer voluntary services. So if, parent or even school staff, we recently started an online referral form, which,
Wow.
yeah, it was really, really great. It opened the door to a lot of kids. So
Let the other kids in the high school know
right.
that.
And they technically could, as long as you know enough information and have enough concern.
Well, I'm thinking about it in a different way. I used to teach high school. I can see those kids. Yeah.
Yeah, send them over there
Let's get
like a
praying.
prank.
Yeah. But
So,
anyway,
yeah, we get them from the schools, we get them voluntarily. So schools are often, school fight, truancy. Truancy is a huge one. So we work alongside counselors and staff at the local schools to get those referrals, police referrals too. So they're not technically charged or have to go to court with something. But the police will refer them to us and say, hey, complete this program, or they might file for them to
Yeah.
go into court.
because
So,
you've been there forever and local cops know you.
right.
Okay. And the court's the same thing. The local district court
Mhm.
does referrals also.
Mhm.
Yes.
I'm a little bit curious. How is the parental participation? I'm sure that's kind of all over the map, maybe.
I would say yes, all over the map. Lately, we have had a lot more parent participation. One thing we started to do is we do hand out gift cards. So every time a parent does come to a parent group, we do send them home with a gift card. We do that to try to get those numbers up because parent participation has definitely been a struggle for our program.
And how do you assess success with a young person?
So when they enter our program, they are the youth and their family come up with some goals. All of those are related to concerns that they've been seeing. We measure those goals. So what we've recently tried to do, or we've been doing, I would say within the past month, is making those goals more measurable. So versus, saying, youth will improve academic performance. Now we're focusing more on what does that look like for each youth, right? So if a youth is absent, every day out of the week, one of the first goals maybe try to attend school twice a week. So we try to measure them very specifically now to get a better range of what success looks like for each youth. That and then completing our components. They learn a lot during those life skills peer groups, as well as those social service learning events.
And you've been doing this for a while. What kind of percentage or whatever of these kids actually do wind up with a conviction or back in court for something else that they hadn't been there before because they just did nutty teenager stuff? So what's kind of the percentage of your kids? Because the whole idea is keep them out of the criminal justice system by, here's an old phrase, behavior modification. So how many of your kids are not successful at that and wind up in front of a judge who gives them 90 days or whatever the judge is going to give them?
I would say a majority of our cases don't recidivize, but I think part of that is due to how we get them. So we're already getting cases that aren't necessarily to the severity of facing time or being put on probation. So that gives us a leg up, because if most of our cases come from one school fight or come from truancy, most of the time those aren't the types of things that are going to recidivize. Like retail fraud is something I always think about, where I can almost guarantee most of them are not going to do it again, because that's just common in shoplifting. I would say a majority of them don't recidivize or do not go further into the justice system. Some of them come with this, assume that they probably will continue to go further down the line just based on how seriously they take our program and their own behaviors and their parents as well. How accountable are they being held at home? All of those things kind of allow us to predict which specific youth might continue. But for the most part, I would say a majority do not recidivize.
And Madam Chair, I'll just comment, the money that we spend on this and we keep kids out of the system is a good investment. If we just look dollars and cents, it's more expensive to run them through the court system, to have jails to put them in, to have probation officers tracking them down. So I love spending money this way. Thank you, Madam Chair.
Thank you, Commissioner McCormick.
Thank you, Madam Chair. I too agree with Commissioner Colleen. I'd rather be proactive and try to catch them before they get too far, because we all make mistakes in life, especially when you're young. What would you say is the top 3 issues that our youth, your youth, are having right now? Top 3.
Truancy
Truancy
immediately comes to mind. It's, I think, getting worse and worse and worse every single year that I've been doing this. More and more alarming how not seriously it's being taken
by
the parents. Yeah, I would say by the parents or the adults in their lives who are allowing it or not encouraging them to go to school. Maybe
I would say support.
Additional,
yeah.
voluntary.
A lot of our youth that come to our program really struggle once they successfully complete to leave our program. And it's due to not having, a lot of support in their life. So,
okay.
Then maybe fighting.
Fighting.
Yeah, it's usually assault and battery is the charge that they'll look at, fighting or retail fraud. Those are the crimes that I think of the most.
And the retail fraud, would you say that's from basic needs? Or
it depends.
Okay.
It really depends. Sometimes it'll be the silliest things. A lot of them, maybe the initial time were basic needs, and then it was, oh well, I didn't want to ask mom, and I wanted this thing, so I'm gonna take this thing.
And that goes to my last point. Parents, you talked about giving them a gift card to come into a meeting. I remember when I was a parent leader for so many, a lot of years, I'll say it that way. And that was one of the things we would either feed them or, some incentive like a gift card at the end of the meeting for staying, which sounds kind of crazy that we have to entice parents to be more involved that way. But we do know that if you can get the parents in, that's half of the battle, because they still have to go home to their parents and deal with life at home. So my question is, how are you impacting home more so than just bringing them to a meeting? Is there any other wraparound services for parents? Because, a lot of the times it's really difficult as a parent to provide and to be there for the child. And then that's why you have children acting out, because they don't have it at home. So do you work with other groups to help parents, or what does that look like?
Yeah, so we do attend, we ourselves attend wraparound meetings to learn more resources that we can provide for our families to help out with the parents. Again, we do offer those parent education support groups, but we're, very aware that it's rare that they're going to attend. One thing that has been helpful is having meetings with the parents. A lot of our parents that aren't as involved, in the youth's life, a lot of times we are able to have them come in for meetings. I would say at least at least 5 times while the youth is enrolled with us. A meeting should be had with, a family meeting where the parent can discuss their concerns. We can provide resources for some of those concerns. But yeah, most of that is done through meetings, and then providing them additional resources.
Are those home visit meetings?
So sometimes they can be. We are able to visit the home if the parent is comfortable. Sometimes you have a parent that's just not comfortable with that, but the majority of our families have been very comfortable with us visiting them at home.
Yeah, because if you can kind of see what's going on at home, it's helpful in trying to, help the youth as well. Thank you. Thank you for all that you do.
Thank you.
What kind of wraparound services?
So we attend the Hagera community wraparound meetings, and we usually it's more of like a case by case basis. So if we have in our mind a case that we need help with specifically, for the most part, I think when we're taking on a youth, we're also understanding we're taking on their entire family. So me personally, as their case manager, I acknowledge that I'm working with the parent almost as much as I'm working with the kid. So that can look like offering the parent a lot of support. But if I have personally acknowledging an issue that may be present, I'll bring that case and say, hey, this is what's going on with this parent specifically. Does anybody have any resources to offer? Maybe that's food assistance. Maybe that's, housing insecurity. That could be legal advice, even if there's a custodial dispute. It's really case by case, I feel like, and we'll bring that there and get resources because I'm still finding things that are new in Wayne County. So we'll bring it to other people who would know better and go from there based on, what their parent need is.
All right. Thank you, Commissioner Mareki.
Thank you, Madam Chair. So Paul is the director.
Mhm.
So it would be helpful for me if Paul could send us any statistics about some of the stuff that has been asked today. Because we've been able to get statistics from other groups,
Yeah.
Success rate, all that type of thing. So if anybody could relate that to him.
Yeah,
that would
of
be
course.
very helpful. Thank you.
All right, thank you. Anyone else? Okay.
I can go next. Marquita Felder from Southwest Counseling Solution, now my side. We merged as of 2 years ago. We are a community mental health organization, and we have been providing youth assistance since really 2009, so quite a long while. Our services are pretty comparable. The only thing I will add is that we do individual and family counseling, so we go in weekly for those sessions. Our services last about anywhere from about 110 days is the average length of stay that a young person will remain in youth assistance. They can go beyond that with extensions, but that's pretty much our average. So the individual family, we also do the psychoeducation groups. We're in 2 different public schools currently, where we actually go in the school and provide life skills, anger management, some substance use education, as well as a big one is really healthy relationships. So we're dealing with for high schoolers, a lot of domestic violence concerns there, a lot of social media bullying is another heavy topic. So we're in the schools providing those life skill groups weekly. We also provide life skills groups at our center. We provide transportation to and from the center itself. Our staff do their bachelor's level social workers and/or some of the other fields. I'm sorry, I'm a social worker. But what else do we do? We have mentoring services that we also offer. We have 2 full-time mentors that will provide some of the tutoring support that they need. So we are meeting with them anywhere from 1 to 3 times a week. So it's pretty intensive. And some of our outcomes are, you asked about so the way that child care funds ask us to report out annually is the number of youth that have received a formal authorized petition while actively enrolled in the program. So unfortunately, we don't look like in the CMO world, like recidivism over time, but we do look annually. So when that report is due, we look back at all the youth we service and to determine if there's been any additional contact with the justice system. And for 2025 is what I'm reporting out. Our numbers were 0. And we have serviced anywhere between 50 to 80 youth is what we average every year. This past 2025, we only serviced 50 youth because we were short-staffed. So that's one number. And then the number of youth charged with a new criminal offense while actively enrolled in the program, and that was also 0 for us for 2025. I think there is one more statistic that I thought was important to note. We are our zip codes are primarily our grassroots was in Southwest Detroit, but we have expanded outside of Southwest Detroit with our merger with Development Center Inc. So we are also in Northwest Detroit. So zip codes 48201, 202, 204, that's kind of west side of Detroit. So we're in about 9 zip codes at this point in time, 7 to 17. We also received the Right Track referrals. I'm not sure if you guys are familiar with Right Track, which a lot of times those are the youth who've had one contact with the justice system. And so we do get those referrals, but the majority of our referrals are coming from the schools. They're coming from the CMOs. They are also coming from just families that are receiving services with us from the clinical, our behavioral health side. So we do a lot of internal referring because we are an organization that provides a full array of wraparound services. And I think you asked the question, what do we do? So once we determine if if their needs are greater than like the individual counseling that we do, we do refer them, whether it's in-house or a CMH, community mental health organization of their choice, where they will be receiving the follow-up psychiatric services and or if there's substance abuse needs that are greater than what, your youth assistance staff can provide, then we have those connections where we're referring them for individual counseling specifically for those types of needs. And try to see what else I can add there. Also, so in terms of our goal obtainment, so we base that off of what she mentioned, like your treatment plan goals, as well as there are assessments. It was formerly the CAFAS, now there is the YAZI, right? Okay, all right. YAZI is an assessment tool that's brand new. I mean, we just started that in October, so we don't have a lot of data with that. But with CAFAS assessment, they look at all the life domain areas like mental health. They look at how they're doing in school. It looks at can't think of some other areas, but a full array of life's domain areas. And that's how we base our outcomes, the treatment plans, as well as those assessments that we do. And for us, we showed that 94.7% of our young people in 2025 obtained their goals, their treatment goals. And so that's pretty high. So, yes.
Thank you. All right, any more? Commissioner Kling?
Here. Every citizen in the United States ought to be extraordinarily concerned about how few of our kids show up to school.
Yeah.
And not miss more than 30 days in a semester. So the services that you provide in the schools would include?
It is only group work. So not only, I shouldn't say that. So we go in once a week, our staff, and they're providing life skills groups, and they will refer. So if a counselor or a teacher identifies a young person as having some challenges, we can enroll them in youth assistance. Those youth are not enrolled technically in YAP, meaning like they're not, they don't go through the process, but this is a part of our youth assistance program that we are in the schools providing the support, providing case management, as well as resources. Yeah.
So you do life skills for everyone?
Correct. For the entire school.
The other kids, go back, I taught in high school for 15 years. Are the other kids aware of who's in the YAP programs?
Are the other kids
And
aware?
is there any stigma attached to that among the kids?
Absolutely. I mean, they could probably speak to that more. Me as an administrator, I'm only taking a guess at that, but I would definitely say there is a stigma
Yeah.
attached to that. But we do try to approach it very, privately. There's private room that's available for us to meet with young people, and so forth.
Because that makes it really tough on the young person
It does, but
you're dealing with, and then
because
kind
we're
of the teasing or whatever.
yeah. But because we're providing it for the entire school, like
Yeah.
we actually have full classrooms and then we do break out if there is, let's say a school may bring up a particular issue with like, they've been having an influx of like domestic violence and relationships, or they're hearing about them. So they'll ask us to do a special group for that. So those are more private and closed off groups. But for the most part, our substance use education, all of those is open to the entire school. So it kind of decreases the stigma in some ways in that respect because everyone's getting it.
And then finally, what do you see are the biggest gaps that these young people? I taught in a school district where 70% of the kids didn't have a father in the home. What kind of gaps do you see with these young people? Like, you probably have 2 or 3 things that they're missing, that they're not getting to become adults. What are the couple of things at home that really impact the youth?
So we focus a lot on, believe it or not, some of the basic skills that I think has been removed from schools is even learning how to basic things like life skills. That's huge. So it could be even learning how to take care of your parents. Let's say parents are at work or they're somewhere else, and so a lot of times, so it's managing, your time. It's also a lot of things is, I think idle time is the biggest. That's what I would say. We try to focus on pro-social activities because what we're finding is that a lot of young people, once they're going home, they're not necessarily going home and they're actually influenced. They're being influenced by a lot of things. Social media you don't have to.
Let's go walk the neighborhood.
You don't even have to leave the neighborhood to be influenced because of social media now. And so I think an idle mind, there's a saying, idle mind is the devil's workshop. I think what we try to focus on is those pro-social. And I didn't mention that we do recreation summer activities. We purchase memberships for most of our youth so that outside of us, they can have that connection to the community. And so I think that's one thing that's missing is that interaction, the positive pro-social supports and activities. I think that's huge. I think that's the biggest part of the problem. I mean, you can try to educate, you can oversell all these other pieces, but you're fighting against kind of some of those peer norms, right? And so you've got to find something that interests them and make that connection for them. And that's where the mentoring comes in, where they can work with them individually. So I hope I answered the question,
No,
but
it is
that's a big piece.
It's very huge because they're hearing stuff from you and they're like, well, that's not the way it is at home.
Yeah.
So the heck with that, right?
Yeah.
Or you have students who'll tell you, well, my mom didn't get out of 4th grade. I don't know why I have to go through, all the way through high school, right? And it's just what they bring. Money skills. Is that something like, this is a credit union? You can open an account here. You can because that's a real kind of a basic thing too.
It is.
So those kinds of things are among the things that you.
Good. Glad you asked that. We actually have helped young people start bank accounts to getting the older youth, right? Some of them have been employed. I have a few success stories where once they do get employment, they don't know what to do with
They
those
don't
checks.
know.
I mean, this is stuff that, folks that are 20, 21, even up don't have this skill set. And so teaching them young is really important.
Right.
We have a financial literacy piece that we do in our life skills group. So, we definitely touch on that.
Okay, yeah.
Yeah. Some are
Come here,
getting
let
driver's
me
license.
introduce you to the joys of compound interest. for it, and just a very basic thing like that,
Yeah.
and understanding how,
Yeah. Credit as well.
Yeah,
Those are
yeah.
all important conversations.
yeah, stay away from it. Um, well, thank you for all of you guys do. This is such important work. And Madam Chair, I really appreciate that you're leaving time on the agenda for this. Because we don't know. Yeah, we're sitting here, in our big building and everything, proving contracts and spending money. We don't necessarily get a look like this of where that money is going and how it's impacting directly. So I thank you for being here, and I thank you, Madam Chair, for allowing this space on our agenda.
Certainly, Commissioner Moretti.
Just one quick question to both groups. Do any of these kids work in high
they
school?
work?
Do they work?
Yes.
They do.
Yeah. So
Yeah.
a lot of them, we have like a lot of job opportunities in the area that we're able to provide for them, as well as the Parks and Rec for the city of Westland. They are able to take a lot of our youth that do well in the program and they become rangers in the summertime.
Okay, because it sounds like some of the problem, there's too much time on their hands and they're getting into all that trouble. So that's good. I'm glad some of them are doing that.
Yeah, I
That
think
helps.
we had talked, it sounded like we were talking about barriers or, things that are stopping them from being successful. I think that, poverty and socioeconomic status is huge. And sometimes having a job is a privilege. And sometimes not having free time is a bit of a privilege. So I think we inherently are doing them justice by just giving them something to do, so they do want jobs. I would say the majority of the time they want to be doing something. Most kids do. So even if that's not necessarily a job, it's giving them something, giving them a sport, giving them a club, giving them whatever to fill up their time.
Okay, that's good to know.
Yeah.
All right, thank you. Thank you, Madam Chair.
Okay. Thank you.
Thank you.
Appreciate all of you being here.
Thank you.
All right. Okay. Next item.
F, such other matters as may be properly submitted before the committee.
Know of any? Next item.
G, public comments.
Okay, is there anyone online? Oh, okay. Okay, since there's no one online, okay. Anyone in the public, and that's you, so go right ahead. Give your name, please.
Are we allowing
There's a
2
little
minutes?
button down there.
Okay.
You got it.
Hello, my name is Patrice Wilson.
Mhm. Okay, and that's about 2 minutes for
Okay.
comments, please.
I'm a certified grief recovery coach and the founder of Martinez Way Foundation. I am just standing here before you or sitting here before you and as a professional, but also as a mother who lost a son. In my loss, I discovered something critical. We have a system of crisis, but almost nothing structured for what happens after. After the funeral, after the support fades, after the family are left trying to figure it out and how to live again, that's where the breakdown begins. In Detroit, we're making progress, but families are still silently suffering. Parents who have lost children are highly risk for depression and suicide. Siblings often carry unprocessed trauma and it shows up in behavior, school challenges, and emotional instability. And when grief is not addressed, it doesn't go away. It shows up in other communities as mental health crisis, violence, and lost potential. This missing piece is not awareness, it's a structure of healing. That's where I created the Martinez Way Foundation. We help families heal forward through grief. We don't just address grief, we address the grief impacts. Because when families heal, communities are stabilized. This is not just a support, this is a prevention. So today I'm asking for a partnership and to help with this program to be a reference or a referral, a collaborator in violence prevention, a voice at the table for how we support families after loss because I made a decision. What I lacked, another family will not. No parent should grieve alone. No sibling should suffer in silence. And healing families protect our future. Thank you.
Thank you so much. We don't respond back.
Okay, thank you.
All right. Okay. Anything else?
Adjournment.
Yes, okay. All right, moved and supported, all in favor? Aye, we are.